Lindsay, Albanese. I'm a physician and CMO over at Atracare Healthcare in Sussex County.
Awesome. And can you tell us a little bit about your work in the community that got you selected for this award?
Oh gosh, yeah, it's kind of been a blur, honestly, because we opened my healthcare company like right around COVID. So, a little bit about me is I'm an emergency medicine physician. So, I went to residency at University of Pennsylvania. And when I was graduating, my husband's from Sussex County. So we were like, we're going to move down there. We know it. We're going to raise kids down there. So I worked in the ER for a couple years down there, and we just saw this huge need for outpatient healthcare services. So we took a really big leap of faith and said, you know what, we're quitting our jobs. We're going to start this company. And we did. And we opened right before COVID, like in October, right before COVID. And so we started as an urgent care in a pediatric office with one pediatrician. And during that time, it was like me and another nurse practitioner. We were doing 12-hour shifts, working like, God, I don't even know how many days a week, swabbing hundreds of thousands of patients like during COVID, because really we were the only access point to healthcare for quick, easy, and reliable testing. So we've just been able to expand into primary care, mental health, lactation services. I can't even think of all of the other ones because we've just done so much in such a short amount of time, just because we saw the need to build healthcare better where we're at and provide easier and access care.
And so where do you see yourself and what do you see yourself doing in 10 years?
Yeah, well, there's still a huge, huge need for affordable healthcare and easy access to healthcare, and especially for the underinsured. It's really difficult to fathom how we live in the United States and we have such a lack of easy, accessible healthcare for patients. So I'm hoping that we continue to expand because I think we provide a really great service for our patients, whether it be in primary care for preventative medicine or urgent care for dealing with patients that are sick. We see anywhere from like newborns up to like over 100. We've seen so many patients. So I hope to continue to expand. And I love teaching, and I really love kind of molding these newer providers that are coming out of school that have the energy and the drive. So if they can see what I do and like how I'm passionate about it, I want to continue to grow a good host of providers to continue what I want to do with my company, which is just do as much as we can to help patients. That's really the biggest thing.
That's
Yeah.
awesome. That really is
Yeah.
incredible. And you mentioned affordable healthcare, which
Yeah.
leads me to ask you what policy or other resources do you think would best help Delaware women?
Absolutely. I thought about this a lot because if I had like several wishes, I feel like this is what I would want to change. But I wrote them down really quickly, and I just want to tell you a couple things. Like, I will say, I find that women providers are the best kind of providers. They are compassionate, they are caring. We are able to multitask in so many different ways, right? Like we can get the kids ready and answer a Zoom meeting call and get their lunches packed and get ready for work. I mean, we just have the capacity to handle so much in our brain. So why would we not support those people in the workforce? So one is like childcare for mothers. Like a big thing that I see a lot is that not only patients but moms have to call out of work or maybe can't even go to work because they have childcare issues. There's certainly, I mean, with every sector, there's such a lack of like affordable childcare, and so if you're able to like support childcare for people in the workforce, but also for people who are wanting higher education. I mean, if we can continue to support women and help them with childcare support while they're trying to get an advanced degree, whether it be in person or online, like we would have so many more women in the workforce that can do such better jobs. So that's one thing is like childcare, right? Like even I have issues finding childcare because it's so difficult. All of our childcare facilities down here in Sussex County have wait lists for months and months and months. So that's one thing. Obviously, I'm sure everyone would say this, but continue to support equal pay for women. Like March 14th was Equal Pay Day, and we are still, as women, only getting 84 cents to the dollar for men. I mean, how is that even possible? First of all, I agree that women are way better in the workforce at handling very difficult tasks, but we're still getting paid 84 cents to the dollar. So we need to continue to support equal pay. And it's even worse for women minorities and women of different ethnicities. That's a huge issue for me. Like, even as physicians, it's kind of shocking that we're still getting underpaid per men. The other thing I was thinking about, another thing on my wish list, was affordable, healthy food. So I really want to continue to provide easier access and easier affordable options for healthy food. I cannot tell you how many patients that we see through our clinics that have diabetes, that are overweight, have hypertension, high cholesterol, even as children. And it really is because of a lack of access. It's less expensive to go buy French fries than it is to get healthy fruits and vegetables, right? So I think we could solve a lot of our issues with diabetes and high blood pressure and high cholesterol, heart disease, things that cost healthcare companies a lot of money, by just having easier access to healthy foods, right? Like, it's just insane that we're still having that issue.
Yeah, it really is.
The other thing I was thinking is preventative healthcare measures for the underserved. So I see a lot of patients through our urgent care clinics that a lot of women that have lapsed on pap smears and have lapsed on mammograms. In fact, I just saw a woman the other day that had pretty significantly advanced breast disease, breast cancer. And it was because she had missed mammograms, because one, it's not easy to get into scheduling them, but it's also expensive. And especially for underinsured that don't have a lot of money. I mean, routine pap smears to check for HPV, to check for cervical cancer, to check for breast cancer. I mean, that's something that we really, as women, need to strive to make easier and more affordable for especially for the uninsured. And I think the other thing I was thinking, kind of to top this all off, is that we really need to continue to support women in politics, right? So women, as I've said, we are kind of like the foundation for family, right? We just know how to be more compassionate. We know how to argue better. We know how to multitask, and we really have a lack of women in politics. I really want to continue to promote Lisa Rochester Blunt for Senate, because we need women like that, especially women of minority, who are going to continue to champion our causes for everything, not just healthcare, not just preventative medicine, but just our children, mental health. Like House Bill 150 passed to help underserved children in schools, especially with the mental health crisis that's going on. So we really need to continue to champion women in politics, for sure.
I love that,
That's my
especially.
wish list.
I know you came ready with
I
the
know,
list,
I'm sorry,
girl.
because we see it every day in my office with my patients that I talk to, especially on the urgent care side, who don't have primary care physicians or sometimes even pediatricians. And it's something where me, as well as my husband, who co-founded the company, as well as the rest of my providers, we're very passionate about that.
Absolutely. And it was great to hear even just a little glimpse into AtraCare and all of the work that you're doing in healthcare. And since we're, a policy related office, and we work a lot on resources for women, had to get that last question in there. I loved everything you had to say.
Yeah.
And we are just, we're so excited to have you as one of our.
Oh, you guys are so sweet. This was completely unexpected. Nothing. I mean, nothing I would have thought of. My new like project right now is to really promote our mental health department that we just opened. We've been seeing, like House Bill 150, we've been seeing such a lack of mental health awareness, mostly with children, and a lot with like younger teenage girls. It's pretty astonishing how much the COVID pandemic affected everybody, kids to adults. I see many patients coming through my urgent care clinic that are just coming to talk about depression, their anxiety. And I'm just like, golly day, like mental health should be a norm, right? We hopefully exercise and eat healthy to take care of our body. Why do we not go to therapy on a routine basis to keep our minds healthy and active? And we really need to keep promoting mental health, because it is so needed, for sure, everywhere.